None noted. The additions to the agenda, Heidi?
Not from staff, Mr. Chair.
Okay. No presentations. Adoptions of the minutes from the October 25th meeting. Can I have a mover and seconder to adopt those minutes? Moved by Councillor Corbett, second by Councillor Van Passen. All those in favor? Is carried unanimously. No consent items, so we'll move on to reports from our general manager first. Heidi?
All of the reports from the October 25th Advisory Committee meeting were approved at Council as presented.
Okay, thank you. We'll move on to, is Dr. Strauss with us this morning?
Dr. Strauss is going to be joining us, Mr. Chair.
Okay.
Perhaps we can go on to the next. Oh, there he is. Okay. We can go to Dr. Strauss.
Okay. Good morning.
Morning.
Go ahead.
Sorry,
Go ahead, Dr. Strauss.
Oh, sorry. I had everything muted. I didn't know I was immediately
Okay.
on deck. So my verbal report through the advisory council chair, I suppose, to the advisory council. So it's been a busy couple weeks. I have a number of things to say. Some will be familiar to Board of Health members. Of course, cases are increasing markedly in our communities. We are doing our best to manage this increase in cases. The preponderance of the increase in cases, I would say, has been in school children, and those most affected by isolation orders and outbreak management and cohort dismissals have been, unfortunately, school children. It's important to note that this increase in cases in our community is part and parcel with similar things happening in communities across Ontario and in our neighboring United States. So it seems to me, and I have discussed this with MOH colleagues and also the Associate Regional Chief Medical Officer of Health, that where our community kind of gave the fourth wave a miss. So when cases were peaking in Ontario, we didn't see too much here back in September. Now places that are maybe geographically, let's say, out of the way. So our communities, Tillsonburg, Elmer, Woodstock, Barrie, Muskoka, Kingston, and several northern public health units, Timiskaming, the Sioux, Sudbury, are all seeing market increases in cases. And likewise, the U.S. states that border Lake Erie are also seeing market increases. So there are particular, I would say, transmission dynamics and also geographic and seasonal dynamics that I think are to blame for these increases. What I have stressed at every appearance that is, of course, it's concerning when cases go up, but we are in such far better position now that 85% of our eligible population has been vaccinated. I, in particular, discussed our increase of cases with my colleague to the west, Dr. Joyce Locke. She, as you may have seen in media reports, is considering a letter of instruction to add some restrictions and things like this. More details will be available in terms of her decision making later in this week. We had a good discussion, and I can say that she and I rather agreed that what she is doing in her community may not be appropriate in our community, and she is responding to particular pressures in her community that do not exist here. I also had the opportunity to speak with Dr. David Colby, who is the MOH for Chatham-Kent. You may or may not be aware, but Chatham-Kent had a real big wave as part of the fourth wave back in September. So I do believe that their cases per capita were higher than ours currently are. And interestingly, that wave settled down on its own without any sort of letter of instruction or further restrictions. And he counseled me to continue pursuing aggressive case contact management, which we are doing. I must let you know that this has been challenging on account of workforce issues. I had a meeting with a Deputy Minister of Health for Infection Management this past week, and I was made aware that there's this remote virtual workforce, which our health unit can access. So we are accessing that. I understand these remote workers will be onboarded in the coming days, and that should help us clear the backlog of case contact management. So I'm happy and proud to have gotten that arranged. So that's the increase in cases piece. Of course, the most concerning outbreak to me, and I think to the whole team here, has been the War Memorial Hospital outbreak. We don't like to see that. I have been in contact with the CEO there, the chief of staff there, and also the infectious disease specialist who is managing their infection control protocols. I'm pleased to say that they're definitely on it. They have identified particular lapses in their safety net. They are remediating those lapses. That outbreak is slated to be declared over on Wednesday. They are starting to receive back some patients that they sent out. As a third point, I wanted to speak to press releases. I don't know if you saw there was some press about the public health unit's practices regarding press releases. I want to make clear to everyone that our press release policy has not changed. My policy is the same as Dr. Hukowicz's. It is the same, which is the same as Dr. Nsatharai's before him. It has been the long-standing policy of the public health unit not to publish outbreaks at schools. The rationale for this is confidentiality is always a concern, but when it's children's confidentiality that is in question, this is a greater concern for both me and my two predecessors. In addition, if it is the case that the facility has up-to-date lists of who was where, who was a contact, and we're able to contact those folks and tell them what they need to do, then putting it in the media doesn't seem to be of much added benefit from a case and contact management point of view. I know that the community may have perceived a discrepancy in policy, but that perceived discrepancy occurred, I believe, because it turns out that the public and the separate school board have both decided that they will publish their outbreaks. We had an outbreak in a private school, and they decided not to publicize it. So that is how that discrepancy arose. In general, and I've had some conversations with reporters, I am very happy to be 100% transparent about what we can be transparent about. So those things that are not protected by confidentiality. So while we may not be able to say who has COVID and where they live, I'm very happy to be completely transparent about what our policies are and how these decisions are made and what the rationale are. The last piece that I think we're all excited about and is very much on our radar is that Health Canada and the National Advisory Committee on Immunization have approved vaccination for children. It is our intention at the Public Health Unit to start having clinics as early as this Friday. I know there's a lot of hustle involved in achieving that, but our staff are good at hustling. I think that the NACI recommendations were very prudent. They were very well done. The review of the evidence was very complete. And I think of note, what everyone should be aware of is that where previously NACI has recommended that certain age groups should receive the vaccine, regarding 5 to 11-year-olds, NACI is recommending that children 5 to 11 may be offered the vaccine. And they use a lot of language about personal decision-making and taking risk factors into account, and respecting decisions of parents and normal consent processes. So I know that there's going to be a lot of interest in getting children vaccinated from some parents in our community. I know that there will be hesitation from other parents in our community. And I think these NACI guidelines and what has been published are nuanced and thoughtful, and I think there should be social peace on this point, and that is my expectation. Those are my major updates, and I'm very pleased to take your questions.
Okay, thank you, Dr. Strauss. Questions? I see Councillor Corbett.
Yeah, thank you very much, and good morning to you. My questions arise from what is happening in Dunnville, and we've received national review in terms of what's going on, and I've been contacted by a number of media outlets and as to why we're not getting vaccinated. My own view on it is people have religious beliefs, and two, we have people who believe that it's a challenge to their freedom to get them. I thank you for your contingency plan. I know that you indicated to us that if people had a problem, they can get in touch with you. I wonder how many people have reached out to you. I don't think our MP's comments are helping us very much. And wondering where we are in terms of have people reached out to you, our MP's comments, and the reluctance of the provincial government to mandate these and the problem that it causes for us as a municipality and a health unit. Thank you.
So through the advisory council chair to Councillor Corbett, thank you for the questions. I'm going to try to make sure that I keep track of them. So number one, how many people have reached out to me? Dozens. I haven't kept an exact tally. And I would like to say I have all the energy in the world and all the time in the world to have those conversations. I wish it was dozens more. There was a suspected outbreak at a house of worship. I called the pastor and said, if any member of your congregation wants to talk to me about this, please, this is my cell phone number. I have not had any uptake from that particular faith community. So I think the short answer is dozens. I wish it was dozens more. Regarding the MP's comments, when I was asked about this at a press conference, you may know that I declined to comment. I really want my office to be not involved in politics. My perception is there's been more heat than light surrounding those comments. I would say that I've met with our MPP. We had a really good discussion about the way forward and his view of community concerns and my view of community concerns. And of course, I always appreciate speaking with the councillors from either community. So I think my comment would be I'm sure that the MP is well-meaning. I wish that I'd had the opportunity to discuss some of those things with her not in the media. So I think it's, again, I don't want to be editorializing on any particular person's comments, but I'm here and I love giving advice. So medical it is, but I don't political advice. So that's about as much as I think I should say on that. And I cannot recall through the board chair to Councillor Corbett the third question.
If I may, I must tell you that as a councillor, I've received comments from all across Canada supporting her view, and that seems to be contrary to what the information you're putting out. The other question was with regard to the reluctance of the province to mandate vaccinations, which puts us in a dilemma.
Right. So to take your question as to what is my view about mandating vaccination, I mean, I think the major question is in what setting and what is meant by mandatory. Ultimately, as a physician for the last 10 years, I have never mandated my treatment on anyone except in very rare circumstances where they were incapable and it was an emergency and we couldn't get a substitute decision maker. So extremely rare, and I don't like to do that. So the major principle in medical ethics that I've governed my practice by has been informed consent. So now there's a lot of nuance in these discussions about ought we to be calling what is happening right now mandatory vaccination, or ought it to be called a vaccine requirement? So you're required to be vaccinated if you're going to work in a nursing home, but nobody's going to drive around and apprehend you and hold you down and inject you, which some authors would say would be mandatory. And it has just long been my view that having conversations with folks, doing education, expressing concern for their personal health, talking to them about the repercussions for community health is just more effective than force. I think force kind of, for every force, there's an equal and opposite opposing force. I think is that Newton's second law. So I'm more comfortable making recommendations and having informed consent conversations with people myself. So,
Okay, thank you, Councillor Corbett. Any other questions for Dr. Strauss? I don't see any hands. Dr. Strauss, thank you very much for joining us this morning. Enjoy the rest of your day.
Thank you all.
Okay, we'll move on to staff reports. The first one being on page 7, it's staff report HSS 2123, and it's in regards to the update for the 10-year housing plan from 2020 to 2030. Heidi, who's going to address this report?
Thank you, Mr. Chair. Stephanie Rice, Acting Director of Social Services, and Tricia Givens, the Director of Planning, co-authored this report. So I think Stephanie's going to lead the presentation, and then both will be available for questions.
Okay, thanks, Stephanie.
Yes, thank you, Heidi. Thank you, Mr. Chair. Through you two members of the committee. The original 10-year housing and homelessness plan was presented last year, and at that time, staff were directed to follow up with a report outlining the financial impacts and aspects of some of the action items listed in the plan. That is what this report is to do today. Tricia Givens has joined me, so thank you very much, Tricia. Tricia and I worked collaboratively with our finance department as well to gather as much detail and information to make the report as meaningful and fulsome as possible for council for information and decision. The purpose of the plan is to have a long-range action plan to help us problem solve and make decisions moving forward to address the housing needs in Haldimand and Norfolk counties. So the plan is a mandated component of our Housing Services Act in order for us to deliver services in our counties. The action plans outlined in the original report were broken down into a chart that's been attached to this report for easier viewing. As you can see through the financial chart, many of the action items do not have a financial impact, and so where that is the case, not applicable was outlined. However, there are some action items that could have financial impact, levy impact, and those are noted as well. Some of the noted implications are addressed through, we would need to know the scope of the project. We would need to know the size of the project to be able to get a fulsome idea of the financial component. Essentially, no matter what were to come forward, anything that would have a financial impact would be brought forward to council for decision for either county. And so I want to be clear, it is included in the report, and I know there were comments made by both Haldimand and Norfolk Finance. There wouldn't be any work done without a report coming through to council for decision. So the work that we did is to provide our best summary for you without having specific projects that we're bringing forward through a report, to give an overview of the potentials. And so again, the plan is a mandated plan for us to have as the service manager for housing in our communities. And we are required to have this in order to provide us with a long-term plan to guide us in our decision-making, and any projects that would come through to support us in addressing the urgent housing needs in our communities would be done through a report to council for decision. This report is fairly short. Attached to the report is the original housing and homelessness report. the plan. There's also a presentation that was to be delivered last year, which I do not believe was delivered, and the financial impact chart. So there's quite a bit of information here. But what I'd like to do is turn it over to questions, ask Tricia to also weigh in on answering any questions as appropriate, please. Thank you.
Okay, thank you, Tricia. Questions? I see Councillor Corbett.
Yeah, thank you very much. Thank you for the overview. I have a number of questions. It mentions in the plan advocate. How are we advocating to see some of these plans go forward?
Thank you, through you, Mr. Chair, to Councillor Corbett. So advocacy is a multifaceted approach. Advocacy is best done through working with our community partners and agencies. And so I would pair advocacy with education. And so part of what we do is get our information out, the message out, work with our community partners so that they understand the work that we do, and then continue to advocate to work collaboratively to address homelessness effectively in our communities and housing needs in our communities. It's clear that it is a community approach. And so our work is to lead, guide, and direct, I would say, the community in moving together. So advocacy can look like many, many things. I'm sorry, that's probably not a specific enough answer. If you have a follow-up question, Councillor Corbett, please feel free to ask that, and I'll try to be a little bit more succinct.
That's good, thank you. If I may, we're dealing with YIMBY versus NIMBY.
Yes.
And are we commenting on planning issues? What I'm getting now is that we're in the place of infilling, intensification, and up, not out, and that seems to be giving some of a problem for the neighbors. And I'm finding myself, we have to do something for the community, not satisfy the whims of the neighbors who, you can't tell your neighbor what he's going to do. What's your thoughts on this YIMBY versus NIMBY?
Thank you, through you, Mr. Chair, to Councillor Corbett. I think that's an excellent point, and it is valid. Visibility of homelessness and housing needs has really become exacerbated through COVID. It has pressed the issue front and center. And I agree that there is a notion that, the NIMBY, we don't want to have that. We don't want to see that. We want it addressed. Again, collectively, we need to do so as a community. And I agree that we do our best to ensure that, neighbors and people feel supported, but we really need to take some action in order to address the needs across the community, because the reality is that housing is the only solution to homelessness. And in order for us to move forward with a housing solution to satisfy everyone, in the end, it will satisfy everyone. I guess my long-term vision is that it does satisfy everyone in the end, but for certain, there is a tendency for people to feel uncomfortable. Sometimes some people can feel uncomfortable when there are visible homelessness challenges in the community. And so I think that's probably sparking some of that conversation and people coming forward with their views on what they think that should look like and what that could look like. I think at the end of the day, we really need to understand that housing is an urgent need across both of our counties, across the country, actually. And unless we start to do some really good work to address it, it's only going to get worse. Thank you.
Thank you. And my last question has to do with rental housing needs. And I can understand why no contractor or builder wants to get involved in a rental housing. The pendulum has swung too far one way when it takes a year to get a person out who hasn't paid the rent. Why on earth would they want to get involved in the rental business? What's your feeling on it in terms of our housing? Why isn't the private industry, the private sector, getting involved in building apartment buildings? I understand they're to make money, but I can tell you in this climate, I wouldn't want to be in the rental business. Just for your comments, please.
Thank you, Chair, to Councillor Corbett. I think for this question, if it's okay, I'd like to turn that over to Tricia Gibbons to comment on that from her perspective. Thank you.
Thank you, through the chair, to Councillor Corbett. Can everybody hear me okay? Can you hear me okay?
Yes.
Good. So I think there's a number of reasons and a number of barriers, perceived or otherwise, for the construction of rental housing. The first one being is it's very expensive. So the creation of rental housing, purpose-built rental housing, costs a lot of money. So comparatively, when you build a single detached dwelling or a subdivision, you build them, you sell them immediately, and there's a cost benefit immediately. When you're constructing purpose-built rental, there's a significant amount of investment at the front end, and there isn't really any gain to the builder until over time, until rent has been paid, essentially. And so one of the barriers, as indicated, is what happens when you have tenants who aren't paying, et cetera, et cetera. So what we're seeing is, and that's part of this plan, is a suite of potential incentives to incentivize builders and developers to build purpose-built rental housing. And give them some of the perks. So whether it's waiving or deferring development charges, or waiving or deferring permit fees, or even planning fees as some incentives to help draw the rental housing into the community. The other piece in the plan that was identified was creating supports for landlords. So that's also within this plan, is creating a committee or a group that would provide somewhere for landlords to go to get help in managing or working with tenants that might be struggling, whether it's to pay rent or with mental health issues. So we're trying to capture both ends with incentivizing developers to come into the community and build, and then providing supports to landlords that might need them to manage and support tenants. So hopefully I've addressed your questions.
Thank you very much.
Councillor Huffman.
Thank you, Chair Del Monte. I guess my question is, and I guess maybe I do mean to be blunt. We're talking about advocacy, and we're talking about reports, and we're talking about collective work and things like that. And obviously, I know last week there was the homeless enumeration, and it's been stated that COVID has kind of brought things forward. But what I'm wondering is, just after being on this committee for 3 years, what is our actual progress that we've actually had, very tangible progress? What is it in terms of dealing with homelessness? I haven't seen any real solutions, I guess, in my almost 3 years of being on this committee. And I just wanted to know kind of where we're at. What are we using to gauge our progress?
Thank you. Through you, Mr. Chair, to Councillor Huffman. I see that Heidi has her hand up, so I'm going to allow Heidi to address the question to begin, if that's okay. Go ahead, Heidi. Thank you.
Thank you, Mr. Chair. Through you to Councillor Huffman. I think that there are a few different things that we can look at in terms of progress. As Stephanie mentioned, one of the most important solutions to homelessness is the construction of new housing, or the creation of new affordable housing. And over the last number of years, we have, with federal and provincial funds, created more than 100 units of new affordable housing, some of which has been with supports. We have 22 units of senior supportive housing in an additional 14 units on the same property, building like a campus kind of environment. We've seen 35 permanent units plus 5 emergency supported units at Hamilton Hall, with another 51 units under current construction to be open this year at Dogwood Suites. Additionally, we have found creative ways to use our provincial funding in order to create new affordable housing with supports in the private market. So we provide housing allowances and rent supplements, again, with our provincial funding, to community partners like the Canadian Mental Health Association, the Norfolk Association for Community Living Haldimand, and Community Living Access Support Services, to support people who are living with a developmental disability in non-24-hour group living, so that they can have affordable rent and the supports that they they need to live independently within the community. I think one of the other places where we have seen success is in our community response table. So that was initiated by the Ontario Provincial Police. It's a crisis stabilization table where the key partners in the community, including us, are there to create immediate safety and intervention plans for individuals in our community who are assessed to be at imminent risk of danger to themselves or others. I think that we need to, as has been mentioned, the fact that we have visible homelessness in our community does not mean that we aren't making progress. So when we engage with those individuals and have conversations with them where they are at, and when we are successful in bringing them into emergency housing, even if it's for just one night or 2 nights or 3 nights, that's all that they can tolerate, that's success. And when we are addressing homelessness, particularly when we are engaging with and supporting those who are most vulnerable and with the most complex needs, who are usually those people who we visibly see living on the street, we have to measure success differently. And sometimes that success is in baby steps. And getting someone to come inside for 1 night, that has to be success, because maybe they're not used to sleeping inside in a bed and talking with other people. And so, we measure success in those ways. And that's how we continue to do our work. So hopefully that has answered the question.
Yes, thank you, Heidi. It has, because I think in our community right now there is a perception and that we're dealing with more homelessness than normal, and I think that somehow, some way, the message that you just spoke to needs to get out into the community in terms of the successes that have happened. So in regards to some of the successes that you mentioned, now when we came into council, Hamilton Hall was in place, and we were part of the council and the Norfolk council that brought forward the proposal and voted on it for Dogwood Suites. And I just think that sometimes we need to get our successes out there a little bit more for the public to see, and that sometimes it just gets a little convoluted and it's hard to see the light at the end of the tunnel. And you're right, getting someone in who's experiencing homeless instability in terms of housing, getting them maybe inside for 1 night is a big win. Because that can be a big struggle. So I would just like to see us be able to kind of shift the narrative and pivot a little bit and let the community know of all of the great successes that we've had, instead of continually kind of that, as Councillor Corbett maybe mentioned, that not in my backyard kind of thing, and that, that visual thing of someone camping on the front lawn of council chambers and things like that. Those tend to take away and detract from the great successes that your staff and have had. So thanks.
Heidi, Councillor Huffman, in my opinion, raises a really good point. I mean, we're both municipalities were often struggling with communication, right? Getting communication out there to the public. We both have communication departments. Maybe we could do some kind of year-end statement that talks about where we are with COVID and where we are with creating affordable housing, as you outlined. Maybe we can think about doing something like that. Tricia, did you want to chime in here as well?
Thank you, Mr. Chair. I just wanted to add, just as somebody who's been away and watching the housing and homelessness teams, the thing wanted to also flag as a great success, in my opinion, is the creation of the homeless team that came in-house, because the other key missing item is we now have live data And I think the program can respond to that data collection, and knowing the community at a basic level, I think is also a success, in my opinion, of the team. So I just wanted to add that in there as well.
Okay, I have Councillor Patterson has a question or a comment.
Thanks, Chair Damani. Just a comment. A big thank you to the authors of this report. It's pretty in-depth. There's a lot to absorb. Good thing it was a rainy afternoon yesterday and we had time to read through it, but I'm just hoping it's going to be shared with other groups and individuals and just not left kind of to collect dust. And just on that, if we are going to share it, I just want to highlight there was a bit of a #41. Just if we can change it electronically. I know it's hard to do on paper, but the projections for both Halton and Norfolk in 2041 for population, we're still stating the 2016 numbers. So just if you can make a note of that, and if it's possible to correct that on page 51 would be awesome. But other than that, it's a great report. Thanks for the time.
Thank you. Through you, Mr. Chair, to Councillor Patterson. Thank you very much for the comment. Yes, that correction definitely can be made, and I appreciate the feedback. We recognize there's a lot of information in the report, but it was really important to us to make sure that everything was included together, because it all pieces together, and it is a fulsome document deliberately. In terms of being shared, yes, this information will not just sit and collect us. This information is a number of things. It will be posted on the website for one, shared out in other ways. I like Councillor Delamonte's idea of using our communications departments together to do updates. Perhaps some of this information can be included. Just a thought on how to leverage the opportunity to share the information with the public, and ensure that people understand the work that we do in the plan. But first and foremost, having this plan in place is it's the key to allowing us to move forward with some actions to address the known challenges and issues within our county. So I think for me, I see it as the document to sort of step into that future and to start to do some deeper work, which is absolutely needed, has been needed before COVID, but is even more pressingly needed now as we move into the future. Thank you.
Okay, I see no other hands, so I'm going to deal with the motion on page 9 of this report. Can I have a mover and seconder to get it on the floor? Councillor Patterson's moved. Councillor Huffman is seconded. All those in favor of this motion? It is carried unanimously. Okay, so we'll move on to the second staff report, HSS 2124, and it's in regards to the 10-year housing and homelessness plan. Stephanie?
Yeah. Yes, thank you, Mr. Chair. Me again. Thank you so much. This one is a bit shorter, not so much information included in this report. The reason for this report is that, as I had mentioned in the previous report, the 10-year housing and homeless plan is a requirement for us to have in place. And part of the additional requirement for that is that we give an update to the Ministry of Municipal Affairs and Housing on progress. So this report is a synopsis of 2020, which was a challenging year for many reasons, but the report is still due to the ministry, and is also an opportunity for us to reflect on some of the work that has been done. My hopes are that we will see these reports be more fulsome as the years progress, and be able to add more detail and more successes to this. Attached to the report is the, again, just a snapshot of the report on progress, the different areas, the 4 major goals of the housing and homeless plan laid out with a bit of a synopsis of the progress that's been made in each of the goals, and some future planning initiatives as well, starting to think ahead to 2022, which is almost here. Hard to imagine. I think that I'm just going to leave that there, and I'll open it up to questions, just because it might be easier to address them, to ensure that I cover any gaps that there might be. Thank you.
Okay, questions of Councillor Corbett?
Yeah, thank you very much, Stephanie. Question I have, the concern I have, is you put in a lot of work to prepare these reports. They go to the ministry. They end up in file 13, or do they actually take any action on them?
Thank you. Through you, Mr. Chair, to Councillor Corbett. That's a fair question. Absolutely. The ministry is requiring these for their data amalgamation, and they do use the information to inform decisions on funding and so on and so forth. Locally, we use these reports for our own purposes and planning. So the envelope that we are given, the provincial funds that we are allocated in order to support our communities, these reports and these actions continue to guide us as we move forward. So I appreciate absolutely the reports are a lot of work, but they are done for purpose, and the purpose is local as well. So we're able to use the information to make some decisions and direct where the needs are in our specific community. The province is interested in the data as a provincial overview, and then also to assist them in making decisions around funding for each community. This information will also be, if it is approved and staff are directed to do so, this will also be shared on the website and made publicly available as well. So people will get a sense of what we are doing, the progress that we're making, and so they're able to interpret the information on a more local scale, so they see the work that's being done in both of our counties. Thank you.
Okay, thank you. Any other questions on this report? Not that I'm going to deal with the motion on page 160 of the agenda. Can I have a mover and seconder? Councillor Taylor's moved. Councillor Corbett has seconded. All those in favor of this motion? It is carried unanimously.
Thank you.
Next report is on page 166, staff report 2125, and it's in regards to the community safety and well-being plan.
Thank you, Mr. Chair. This one is for me. So the community safety and well-being plan, the plan was distributed to members of council when it was finished in draft. And so now this report is meant to give it official approval so that we can release it publicly and get working on the action items. So this was a directive of the Ministry of the Solicitor General that each municipality have a community safety and well-being plan. Haldimand County and Norfolk County decided to do one plan for the two-county area and identify social services, health and social services to take the lead. We were able to use the community needs assessment that was completed by our epidemiologist in 2019 as the basis for our community safety and well-being plan. And then we did some additional community consultation and using the provincial planning framework that identifies 4 key inputs that are listed on page 2 of the staff report. Specifically social development, prevention, risk intervention, and incident response. We identified 3 key areas and actions to work on, specifically mental health and addictions, rurality and poverty and homelessness. So moving forward, we are, as I said, we are looking to make the plan public. We're looking to develop an implementation group that Health and Social Services would take the lead on for both counties. And we would be providing annual updates to both counties on progress in meeting the objectives as outlined in the Community Safety and Wellbeing Plan. And with that, I'd be happy to answer questions, Mr. Chair.
Okay, thank you, Heidi. Are there any questions on this report? Councillor Patterson.
Thanks, Chair Damani. Just a comment, not a question, just for future reference, Heidi, when you're looking at focus groups, I see you mentioned the chambers and the Board of Trades. The west end of Haldimand, there's 2 others. There's the Selkirk Chamber and the Jarvis Board of Trade. Just when you're looking for further input, if you can just note those groups, would be awesome. Thanks.
Thank you, Councillor Patterson.
Okay, I see no other hands, so I'm going to deal with the motion on page 172 of the agenda. Can I have a mover and seconder for that motion? Councillor Corbett's moved. Seconder, Councillor Taylor. All those in favor of that motion? is carried unanimously. Next is staff report 2126, and it is in regards to the alternative average market rents.
Thank you, Mr. Chair. This one is me as well. So as was committed to, this report is here at the November Advisory Committee for your for your consideration. It is an updated staff report. So since the last time this report was here, it has been reviewed by senior staff at both counties. As well, you can see that there are comments from the Haldeman Norfolk Housing Corporation, and we did do an environmental scan through our Housing and Homelessness Network of the Ontario Municipal Social Services Association. We received, since the writing of this report, we received one additional reply from the County of Simcoe, who also uses alternate average market rents. We received 3 responses at the time of this writing. And just to note that all 3 of those municipalities do have a municipally funded housing allowance or rent supplement program that they use in order to provide deeper amounts of affordability for those who need it. We don't have that type of program in Haldeman and Norfolk at this time. As is noted in the staff report, there are a number of pros and potential implications of implementing alternate average market rents. When all things have been considered, you can see the updated staff comments from financial services and from Haldeman County, and an updated recommendation to approve the alternate average market rents. And with that, I'd be happy to answer any questions.
Thank you, Heidi. Councillor Corbett.
Yes, thank you very much for the report and for supporting it. Social media has not been kind to me in comments with getting the message out in terms of providing affordable housing. They are indicating we're doing nothing, and they have expectations that we will do something. And I'm looking at it that we have to make it viable for people who are getting into business so that they can make money, or at least be sustainable in what they do. They have to make it viable to go ahead. And I think in terms of affordable housing, this is going to be a benefit to us if we can move the yardstick. So I would move it, and I support it.
Okay, thank you, Councillor Corbett. Any other comments or questions on the report? I just want to add my appreciation as well. I see Councillor Van Passen.
Yes, thank you, Mr. Chairman. When we discussed this last time, there was concern on staff about the potential downsides to the very bottom of the socioeconomic scale, and you know, this committee asked that we look at it again because, you know, by definition, the bottom of that scale will always be there. You know, it's much higher than it was 20 years ago, 50 years ago, and there's always going to be need for services to them. But you know, the more I looked into this alternative method, I think it'll help a lot of people who are a little higher up the scale from falling down into the bottom. And that's why I'd be happy to second Councillor Corbett's motion and fully support the implementation of this new system here. So thank you.
Okay, thank you. I see no other hands. So Councillor Corbett, you're moving, and Councillor Van Passen, you are seconding that motion. I'll ask all those in favor of that motion. Motion is carried unanimously. Thank you. So nothing under subcommittee reports, communications, or other business. So we're moving to closed session, Heidi, at this point.
Yes, Mr. Chair.
Okay, so I need a motion.
Mr. Chair, sorry to interrupt, Christina here. just going to ask the IT department, Sebastian, to make sure that Chair, to the advisory committee, we are back live. Thank you.
Thank you.
So thank you, Mr. Chair, through you to members of committee. Before we adjourn, we just wanted to talk about the advisory committee schedule. The next regularly scheduled meeting is December 27th, which is going to, I believe, is one of the stat holidays related to either Christmas or Boxing Day. Staff in Health and Social Services have really worked to get all of the staff reports to you by year end. So I would be comfortable to suggest to committee that we could cancel the December meeting and have our next meeting in January. And that I will be working with the clerk's department, and I anticipate that that would be a live meeting in council chambers. So we would be we would be having the meeting similar to how Norfolk is meeting right now, where committee members would be in person in council chambers and staff would be appearing virtually through Teams. I think myself and Christina as the clerk would be in person. The rest of the staff presenting reports would be virtual through Teams. But I'm happy to answer questions or get any feedback from committee about that suggestion.
I certainly approve of that plan. Any concerns or questions from members of the committee? I see no hands, Heidi.
Okay.
Sounds like a plan. Sounds like a plan.
Thank you. So Christina and I will work to finalize that agenda for January, and I will communicate that out to everyone. The only other quick announcement, Mr. Chair, if I could, before everyone leaves, and before I wish you a very happy holiday season, I do want to announce to committee that Christina Lonsbury is the successful candidate for the administrative coordinator position with Health and Social Services, replacing Kristen DeMulemeister. So Christina will be your key point person for any matters related to advisory committee meetings, agendas, reports, and she will be acting as the clerk for advisory committee. Prior to coming into the administrative coordinator role, Christina has been with us as the administrative assistant for the social services and housing department. So we're really excited to have her move into this new role and work with all of you as committee members.
Okay, congratulations, Christina.
Congrats.
Thank you. Thank you.
So on that note, Heidi, we'll adjourn the meeting, and best of the holiday season to all of you. Take care.
Thank you. Bye, everyone.
Thanks, everyone.
Bye, everybody. Have a great day.
Merry Christmas and a Happy New Year to all.
You too, Bernie.